guys, today we are going to discuss about the drugs. Many people know something about the drug, they think they know everything about the drug, but many are having in confusion between the drugs and the medicines. So we will try to clarify the things today. So drug is a chemical substance. So it is a chemical substance. We have to remember that chemical substance doesn't mean that it is a chemical which is available in the chemistry lab. Okay, that can be present in an Ayurvedic product, in a homeopathic product, in a plant product, in an animal product. So remember that any kind of pathy, any kind of substance which is used a medicine or a drug has got some chemical substance which is going to be effective for certain purposes. So what are the purposes for which this chemical substance will be used? First, it is used for prevention, diagnosis, then of course treatment and symptom management. So drug is a chemical substance which is used for the purpose of prevention, diagnosis, treatment and alleviation of symptoms of different diseases. So first of all, what is prevention? Like we have seen that the drugs like vitamin C, zinc combination, etc. are given for prevention of COVID-19. They are not the treatment for COVID-19. Those were the drugs which will be effective to some extent for prevention of COVID-19. Similarly, there are certain drugs which are used for diagnosis purposes. For example, there are certain eye drops like atropine, homatropine, tropicamide, which are used for the purpose of ophthalmoscopy. What is the purpose? Those drugs will increase the diameter of the pupil so that it will cause mydriasis, so that ophthalmoscopy will be easier and the view will be wider. Then of course there is the purpose of treatment. Many of the drugs are actually used for the treatment of certain diseases, but all the diseases are not treatable. So sometimes in certain diseases we will try to give some drugs which will elevate the symptoms along with the treatment of the cause, and there are certain situations where only symptom management is the only way to keep that person alive or keep that person live his life or her life to some extent. So symptom alleviation or symptom management is another purpose for which the drugs are used. For example, if you have fever, we are giving paracetamol to reduce the fever, then the target of the drug is reduction of the symptom, not the management of the disease. So I believe all these parameters, if they are present in a chemical substance, then that substance will be called as a drug. Thank you.